Small reminder, if any one of you is impatient to see the explanation, then I have written the answers for all the questions in the description of the video. You can directly see the answer and skip forward to the next question. So now let's start. So this is our first question of the day. A and B stay in the same hostel. A is suffering from group B meningococcus and B is suffering from group C meningococcal infection. All are true except educate students and take preventive measures, chemoprophylaxis to all against both group B and C, vaccine prophylaxis of contacts of A, and vaccine prophylaxis of contacts of B. Okay, so answer is C. For students who are impatient, answer is C. Okay, first question, yes, of course you have to educate students and take preventive measures because meningococcus is a droplet infection and you have to use masks and all, whatever. Chemoprophylaxis to all, no, you don't have to give chemoprophylaxis to all because it is only given to close contacts because they stay in the same hostel, so you have to identify the close contacts. Vaccine prophylaxis of contacts of A, this is the right answer. And why not D? Okay, that is because remember that meningococcal vaccine contains only 4 strains, that is A, C, Y and W. It has only 4 strains. So the person who is having group C meningococcus, yes, you can give vaccine prophylaxis to his contacts because it is available. But if someone is having group B meningococcus, there is no vaccine available in the first place. Therefore, you can give vaccine prophylaxis to contacts of B, but it's not possible to give such to the contacts of A because it is not available. B strain, group B, is not available. It's not available. So this is the answer. This is the false statement. So this is your next question. Lagophthalmos is seen in which cranial nerve palsy? Lagophthalmos means lid lag. Okay, so now tell me the answer. Listen, the answer is facial nerve. Okay, so why it is facial nerve? Most of you would have jumped to oculomotor because lid lag, दिमाग में फिर आ जाता है कि okay, it's oculomotor, but it's not like that because oculomotor जो तुम सोच रहे हो, it supplies what? It supplies LPS, right? LPS keeps the eyelids open. Keeps the eyelid open. Okay. But what closes the eyelid? What closes the eyelid? Eyelid is closed by orbicularis oculi. Orbicularis oculi. This keeps eyelid. It closes the eyelid. Okay. Closes the eyelid. So, lag ophthalmos. Lag means what? One eye is closed, the normal eye, but the abnormal eye is not able to close. You cannot close the eyelid. When what will be damaged? You cannot close the eyelid if orbicularis oculi is not working, which means your facial nerve is not working. Therefore, answer is facial nerve palsy. This is your third question. Match the graph with the renal clearance. तुम्हें मैं 4 ऑप्शन दे रही हूँ. 4 ऑप्शंस ग्लूकोज, इनुलिन, बाइकार्ब एंड PAH. PAH क्या होता है? पैरा अमाइनो हिप्यूरिक एसिड. So now you have 4 graphs A, B, C and D and you have to match which graph represents which substance as it passes through the nephron or kidney. Okay, so the concept is that, see here, Bowman space and this is urine. Bowman space, PCT, DCT, urine. This is the journey of the substance as it passes after getting filtered by the Bowman space. फिर वो कैसे, how it is passing into the urine and what is the change in its concentration. So first of all, the easiest one which everyone can answer, the straight line. See, what is it? It is a substance which is neither reabsorbed nor it is secreted. Reabsorbed means it will be carried away from the urine or filtrate into the blood, and secreted means it will be secreted into the urine. So basically this thing, after getting filtered in the Bowman space, nothing is happening to it. So no change is happening to it. So this is the famous one, inulin. Inulin is the ideal material for measuring GFR, but we do not use it because it is very invasive. That is why we use creatinine. It's not very invasive, but point is that it is invasive, and that is why we use creatinine as the marker. Okay, so anyway, the C is sorted, inulin. Now tell me something. This thing, the rising graph, after getting filtered, more and more of it is secreted into the urine, and there is more and more of it in the urine as it passes. So this one you may not know, this is PAH, para amino hippuric acid. Here secretion is more of it is secreted into the urine. Then B and A, both of the cases you can see कि nothing is being secreted, rather they are being reabsorbed back into the blood. So now it becomes confusing. Here you see in the urine the concentration is increasing, but the point is here this is a steeper one. This means in the early part of PCT it is happening, early PCT. It is reabsorbed in the early PCT and then it's done. But this one, it signifies ki the late PCT, and also it is continuing a little bit of it gradually, thoda thoda, little. It is also happening in DCT and urine. So basically B, this graph symbolizes which one? Tell me. This is the graph for bicarbonate, and this one glucose is absorbed in the early PCT, very early, and it's done, that much. So this one is the graph for glucose. Okay, because as you know, normal, when we talk about like diabetes mellitus, you must have heard ki arey, this person is having glucose in urine, which basically means glucose in urine is not a normal thing. But bicarbonate, yes, you must have heard कि हाँ bicarbonate exists in urine, bicarbonate तो होता है. So which basically you can imagine like that in a crude sense, that glucose, most of it will be absorbed very early on and it will be more completely absorbed, but bicarbonate, it will take time to get absorbed, and also all of it is not absorbed. Something will come out in urine. So this is your answer. So you have matched it. This is your next question. Imagine there is an injury to the inferior frontal gyrus. Which area will be affected? Injury, vascular injury or whatever kind of injury, your inferior frontal gyrus is damaged. So which area will be affected? Okay, so now let's see. I'll draw a diagram for it. So imagine this is the brain which you are having. Something. It looks something like that. A cortex, I mean, whatever it is. Okay, so there is some kind of gyrus here, and this is the frontal lobe, this is the parietal lobe, this is the temporal lobe, and this is the occipital lobe. Acha, now GK question, can anyone tell me what is the other name of occipital lobe? Occipital lobe is also called as striate cortex. Anyway, so sometimes this can be given as option in MCQ to confuse you. Something will be there and answer will be something related to occipital area, but option will not give occipital. It will write something striate, something it will write striate, S-T-R-I-A-T, striate cortex or something like that. So don't get confused. So striate is equal to occipital. Anyway, coming to our question, inferior frontal gyrus, which area will be affected? So first thing is that this is the line which divides this one. So here there is an inferior frontal gyrus, somewhere here. And here there will be something called a superior temporal gyrus. Now point is that all of you must be knowing that this is not the answer. Visual area, why will visual area be related to here? So now auditory area, Broca's area and Wernicke's area. So this is a purely, there is no concept in it. You have to learn it. So I'll tell you this thing. See, the primary auditory area is somewhere here. It is not on that gyrus. It is somewhere here, the primary auditory area. And Wernicke is somewhere here, and Broca is somewhere here. So Broca is in the frontal, somewhere in the frontal, and Wernicke is somewhere in the temporal, proper temporal area में है, और ये Broca is in the frontal area. Now this, you don't need to remember the detail कि okay, this is the inferior frontal gyrus or this is a superior temporal gyrus. Not needed. Just enough to know that Wernicke is in the temporal and Broca is in the frontal. So now the answer is done. Your answer will be Broca's area. Okay, now tell me, anyone can tell me Broca's area, what is the Brodmann number for Broca's area? 44? 45. And Wernicke area, what is the Brodmann number? It is 22. And what is the blood supply of Broca's area? Broca's area is supplied by superior branch of middle cerebral artery. Wernicke is supplied by inferior branch of middle cerebral artery. Okay? Now tell me Broca's and Wernicke's, what is the function of what? Okay, first thing is that this Broca area, how you'll remember. Broca is about fluency. Are you able to tell, express yourself? Are you able to articulate the words? That is Broca. And Wernicke is about understanding what I am telling you. Are you able to understand my words? So I have a weird mnemonic for it. That is buk. Broca is buk karna. You know buk in Hindi or in regional languages also. Buk बहुत ज़्यादा बात कर रहा है. He is talking too much. So Broca is buk. You are talking. So Broca is about fluency. Broca is about fluency. You are able to talk or not. And Wernicke is about understanding. Or it is, therefore it is also known as, Wernicke is also known as what? Sensory speech area, and Broca is also known as what? Motor speech area. Okay, so got it? Now you tell me in other words, if your inferior frontal gyrus, will be injured, then what will be the problem with the person's speech? Inferior, so frontal, basically frontal is broca will be damaged, and broca is buck, which means talking, he cannot talk, there is no fluency in his talking, so that will be affected. Coming to next question, question 5, which electrolyte is measured in Gettler's test? Gettler's test is measured in what? You have studied it in forensic medicine. It is used to differentiate between fresh water and salt water drowning. But the point is that it is obsolete nowadays. No one believes in this theory anymore. But you can get a question on it and the answer will be chloride. Gettler's test is used to measure the chloride concentration. So it's a historical question, but still, in freshwater drowning and saltwater drowning, it is Gettler's test tells that a difference of greater than 25 mg per dl between the two chambers of the heart, two sides of the heart, will determine, okay, this test is positive. So in freshwater drowning, imagine freshwater drowning, you are drowning in freshwater is getting into your lungs, the chloride or whatever was there in your blood gets diluted because of fresh water, and now from the lungs this diluted blood will enter into your left atrium, which means your left atrium will receive diluted blood with lower chloride concentration. Therefore in freshwater drowning, the right side of the heart will contain more chloride than left side, and in saltwater drowning, by same logic, the left side of the heart will contain more chloride than the right side. Isn't it? The next question, fingerprint develops in how many weeks of intrauterine life? So the answer is 12 to 16. It's a straightforward question. Fingerprint starts developing by 12 to 16 weeks. That is the second trimester, towards the starting of second trimester, and it is completed by 24 weeks. Anyway, the point is that completed question usually does not come in exam. This is what which might come. Now there are a few conditions where there will be permanent loss of fingerprint. Permanent loss of fingerprint will be seen in radiation. Distance between the ridge changes. Distance, only distance will change. That is acromegaly. If your hands are big, the fingerprints will also change. Then ridge pattern is changed. The pattern itself will change. The loops and all whorls, the pattern will change. This is seen in scleroderma. Scleroderma, the pattern will change. Ridge atrophy, the ridge will get atrophied. So this will be seen in what? Will be seen in celiac disease. Celiac disease. So celiac disease, you will see ridge atrophy. Okay? Next question, question 7. Rigor mortis first occurs in eyelids, myocardium, neck and intestines. Give your answer. Answer will be myocardium. Listen, this is a tricky question. Rigor mortis first occurs in, the first muscle to be affected in rigor mortis are involuntary muscle, which means the heart or myocardium. Okay. But if the question would have been rigor mortis first seen in, if it would have been seen in, you cannot see the myocardium. What you can see? You can see the eyelid. So rigor mortis is first occurs in heart and it is seen in eyelids. In a patient with UM and palsy, facial expressions are normal. How? Explain how it happens. Cross regeneration of fibers, incomplete paralysis, innervation by fibers from prefrontal cortex and innervation by fibers from thalamus. So this is something you have to learn. So this is innervation by fibers from thalamus. There are some independent fibers from the thalamus which go to the facial nerve nucleus. So in emotional states, facial expressions can be normal even if person is having an UM and palsy. Last two questions. Question 9. Austin's classification for ossicular chain defects is based on what? So Austin's classification, there are 4 categories, A, B, C and D. So it is based on malleus and stapes. But stapes what? Stapes suprastructure. Malleus and stapes suprastructure. So in category A, malleus and stapes. Malleus is okay and stapes is also okay. Then B. In category B, malleus is okay but stapes is absent. This malleus absent, stapes okay. This both is absent. Okay. And here it is assumed that in where is the incus now? You tell me. So it is assumed that incus is not there. Incus is damaged. It's absent. Okay. So now treatment. Treatment is what? If the stapes is there, then you just need to do a partial ossicular chain reconstruction. Okay. Ossicular chain reconstruction. Anyway. And if the stapes is not there, that is B and D, you have to make a total ossicular chain reconstruction. Okay. This is for AB and this is for AC, this is for B and D. Now, next question. Sanitizer will be used by you in which of the following situations? Before touching a patient, after touching a patient, hands are visibly soiled, and after touching patient surroundings. So let me tell you, this is a multiple choice question. In exam, you will get all these options, and then you will get both 1 and 2 are correct, 1 is correct, 1, 2, 3 and 4 are correct. So that kind. So you tell me which all of the options are correct. Before touching the patient, yes, you will. Otherwise, you will transfer the germs from you to him. After touching the patient, yes, otherwise you will get the germs from him. Hands are visibly soiled. This is wrong. After touching patient surroundings, yes, it is correct. So why did I say that this is wrong? This is wrong because if the hands are visibly soiled, then what is the protocol? No, sanitizer is not enough. You have to use soap and water to wash your hands, okay? So thank you. That's for today.